Thanks so much. Katherine.
Thank you, Charlotte. That's great. Just let me. Okay. Right. Welcome, everybody. It's so lovely to see you. Welcome to the first Somerset Voluntary Community Faith and Social Enterprise Sector Assembly. As I say, it's lovely to see so many people here. We're expecting over 100 actually, and you can see people are still joining as we're starting, which is fantastic. We really appreciate you taking the time to join us today. There are lots of familiar faces, people that I work with on a regular basis, organisations big and small, and we're also delighted to welcome colleagues from County Council, the districts, from health, as well as a few colleagues who've actually come from outside of Somerset. So you're all very welcome. This is very much what we want from this assembly, is that we want it to be somewhere where we can all come together to catch up and share. As you know, Jonathan Higman, Chief Exec of the Integrated Care Board, will be speaking shortly. He'll be here to share his vision for improving health and wellbeing in Somerset. And we'll also be talking about the really key role that our sector will have in this. So thank you so much for joining us, Jonathan. I'm afraid we've received some last-minute apologies from Alan Jones, who's Programme Director for Local Government Reorganisation. Unfortunately, he's got an urgent commitment elsewhere. However, this means that instead, we're very, very lucky indeed to be joined by Sara Skirton. Sara is Head of Corporate Services at Mendip Council, but she's also a lead member of the programme team alongside Alan. So she'll be here to update us all on all things unitary. So thank you so much for stepping into the breach at such short notice, Sara. Look forward to hearing from you later. So, as I say, this is the first voluntary sector assembly, but we're really hoping that it will be the first of many. And we're really looking forward also to doing these events. Oh, somebody's got there. Could you just make sure everybody's on mute for me, please?
Bye.
Oh. We're very much hoping that we can do some of these future events in person. We're doing this first one online just for ease, but we very much want to get together in person going forward. So it goes without saying that it's been an incredibly challenging few years for all of us. COVID, the war in Ukraine, the cost of living crisis have really shone a light on the voluntary sector and the vital work that we do. All of us are seeing really huge increases in demand for our services, right across statutory and voluntary sectors, in fact. And alongside this, we're seeing seismic changes occur in the landscape around us, including the development of the ICS, the Integrated Care System, and the new unitary authority. These changes obviously present a real challenge for us as a sector, but also, I would say, real opportunities too. And with all this going on, we thought it would be a really good idea to provide more occasions like this to get together, to share intelligence and ideas, and to amplify our voice as a sector as well, to problem solve, because there are some really thorny issues out there, and to find ways to work together better. Many of you will know that we did some research last year called Reflect, Recover, Renew. And in fact, many of you were actually involved in that process. So thank you for that. And in that, you spoke really clearly about the benefits of working together, and collaboration came out as one of the really key priorities for the voluntary sector going forward. At Spark, obviously, we're the infrastructure organisation, and one of our jobs is to listen to what you say and to try to help these things happen. However, this meeting today, this assembly, is very much your space. Our job here is just to facilitate this, to get the conversations going. This meeting is just the start. So we're really keen to hear your thoughts today on how you want this to develop as we go forward. We really want your help to shape things so that we're creating more spaces for this collaboration. Obviously, there's loads of brilliant collaborative work already going on across Somerset. And it's great to see colleagues here today from some of those networks that already exist. So Open Mental Health, there's a Dementia Alliance, there's a Youth Work Alliance, and the Somerset Group of Charities. I could go on because there is loads of brilliant collaborative work going on, both county-wide and at a very local level. This meeting here isn't here to replace any of those networks. What we're hoping is that this assembly will be the place where we can bring all those conversations together. The assembly can also be a place where we can level up as a sector. So we've got new organisations here working alongside more established ones, large working alongside small, and also a place where we can start to establish a more equal partnership with our public sector colleagues too. It's also a place where we can start to plan how we can work together in a really challenging financial climate, and also continue to provide much needed support for people in need in our communities. And while this is a space for us, the voluntary sector, to get together, it also provides a brilliant opportunity to join those conversations up with our public sector colleagues, which leads me quite seamlessly, I think, onto my intro for Jonathan. So as I say, Jonathan Higman is the Chief Exec of the Integrated Care Board, and he's going to talk to us about how the voluntary sector can work more closely with ICS colleagues going forward. Jonathan, really warm welcome to you. Great to have you here. Over to you. Thank you.
Thank you so much, Katherine. I don't know what the format for this is, because we've got I think we've got 45 minutes or so, and I'm really keen for this to be sort of interactive. I have got a few slides just in terms of setting a bit of scene, but it would be really good if it was a sort of bit more of an interactive kind of session on that basis. So thank you for the invite today. I'm really pleased to be here at the first of these sessions, and as Katherine said, I hope it is one of many, and that we can start to continue to build that dialogue. So I'm Jonathan Higman. I am the Chief Exec of what's now called NHS Somerset. So again, I'll explain a little bit about this as we go forward. So NHS Somerset is the statutory organisation that took over from Somerset Clinical Commissioning Group on the 1st of July. In terms of me and a bit about me, I've been in Somerset. I've lived in Somerset now for 20 years. I came here in 2002 on my way to home, which is Exeter, and loved Somerset so much. 20 years later, I'm still here, and I spent a large part of my career as the chief executive at Yeovil District Hospital, and just about this time last year, had this opportunity to take off the chief exec role for NHS Somerset, which again, I have to say, being the chief exec at Yeovil Hospital was a privilege. This is a massive privilege as well, and I think we've got a huge opportunity to make a big difference for the people of Somerset as we go forward. I thought I'd just Charlotte Callan is with us as well. So Charlotte is our new Director of Comms and Engagement, and I just wondered, Charlotte, whether you would just pop your camera on, say hello, and introduce yourself as well.
Hi everyone. Yeah, thank you, Jonathan, and thank you, Katherine. Yes, so I'm Charlotte Callan. I'm the new Director of Communications and Engagement at NHS Somerset, and a large part of my work will be working with Katherine and with all of you to make sure that we build some really good relationships going forward. We're certainly not, as Jonathan said, at the end of the journey. I think this is really the start of it for all of us, and it's really exciting. You know, we're really looking forward to seeing how we can develop things as we go forward and make sure that we really bring you all into the decisions that we make across Somerset. So yeah, from my point of view, it's really exciting. I'm always here for you. I always say that I've got a real open door policy. You know, get in touch with me anytime if you've got thoughts on things that we should be doing. Thank you, Jonathan.
Thanks, Charlotte. And maybe Katherine, after the session, we could just share some contact details for both myself and Charlotte. Very happy to. I think I've had a number of conversations with a number of people over the last few months, but very happy to continue with that as into the future. So as I said, I've got a few slides, and what I was going to try and do was to just talk to you a little bit about what is this ICS thing, what's the ICB, what does all this kind of mean, and just try and explain the architecture a little bit of the NHS and what we're trying to achieve. I thought I'd talk a little bit about our developing vision, and Katherine billed it as my vision, and I think the important thing is it's not my vision. It needs to be our vision for how we want to improve health and care in Somerset, and then I thought it would be really helpful for us to have a conversation about how we work together and how we engage and work with you as part of this. It's massively important. This assembly is one part of that, and one place where we can kind of come together, but this has to be a much more sort of dynamic relationship, I think, as we move forward. I will try and share a screen because I've got a few slides which let me just see whether I can. Here we go. Okay. I hope can you see that? Can I just check before I go any further that people can see the slides? Everyone's now vanished from my screen.
Yes.
So yeah, fantastic.
Not
Thank
yet.
you.
Looks
Yes.
fine for me. Yeah. Yes, looks great.
Yeah, that's great. No, thank you. It's very disconcerting. I'm now looking at a screen with a slide on it, and no people. But there we are. So in terms of the way that as an NHS we see Somerset, this goes back to a kind of change in legislation that happened in July of last year. So on the 1st of July, the Health and Care Act introduced integrated care boards and integrated care systems, and they went into statute. And as I said before, NHS Somerset, the Integrated Care Board, it's a bit of a mouthful, but the public name is NHS Somerset. Took over the statutory responsibilities of the CCG, and I'm going to just talk in this a little bit about what's the same and what's passed over and what's different about the Integrated Care Board and NHS Somerset as we go forward. But there were two elements to the statute. One was the creation of NHS Somerset, and the second one was the statutory requirement to set up something called an Integrated Care Partnership, which is a formal committee between the NHS and the local authority, so Somerset County Council, and the first meeting actually of our integrated care partnership in Somerset is taking place next week, which is great. And the job of the integrated care partnership is to work to identify and set the strategy for health and care for Somerset. And the idea is that through that partnership between the council, other partners in the system and the NHS, actually we start to get ourselves into a place where we're starting to tackle some of the wider determinants of health rather than just having a health and care strategy that talks about statutory services. So that's the kind of context for this. Nationally, there are 42 integrated care boards. Comes back to the Hitchhiker's Guide to the Galaxy, I think, and the 42 being the meaning of everything. But so there's 42 of us in Somerset. Our geography is Somerset, and I think that's an important context because some of these integrated care boards are very large in terms of their geographies. So this slide just sets out a little bit about what is part of our integrated care Somerset, the integrated care system in Somerset. So we have one place, which is Somerset. In other systems, the way we use the term place in the NHS, and again, language is really important here because I realise place means different things to different people, but the way we use it is place is the county council or the local authority boundary. So some systems, some integrated care systems have more than one place. I'm thinking about one of our neighbouring ones is Bristol, Swindon and Wiltshire. They have 3 local authorities, so they have 3 places. But for us, place and system are the same. We're serving the population of Somerset wherever they may go and wherever they may access their health and care needs. We've got 63 GP practices which are organising themselves and have organised themselves into 13 primary care networks. And for us, there's a really key relationship here with the developing local community networks in Somerset, and I think a real opportunity that if we can get the geographies right here, that we can start to work at neighbourhood level in Somerset to effect some real change. As I said, one integrated care board, NHS Somerset. We've got 2 foundation trusts in Somerset, so Somerset Foundation Trust and Yeovil District Hospital FT, who are merging into one foundation trust in Somerset. And I think again that puts us in a pretty unique position in the country. We'll be, I think, the only integrated care board with a single foundation trust covering both hospital services, mental health services, community services, and also through a subsidiary, Symphony Healthcare Services, running 20 GP practices. And then from April, obviously, we'll have one unitary authority as well. So that makes our system fairly neat. It also means that the relationships between those parties within the system is going to be really critical if we are going to work together successfully. And as I said before, we've set up our integrated care partnership, and we've determined in Somerset that it is going to be the same as our health and wellbeing board because we want to make sure that we minimise bureaucracy and we don't set up duplication here. But we have some real challenges in Somerset. The challenges of a rural coastal community, an ageing population with quite a big gap between a life expectancy and healthy life expectancy. So people living for quite a long time actually within their life at a time when they're not in their best health. We have I think just the number of people that are here today, we've got a really engaged VCFE sector, working with Katherine and Spark. We're trying to find mechanisms and the best ways to engage with you, to hear your voice and hear your ideas about how we can improve health and care for our population. We're a big county geographically, and you can see there's this border travel times nearly 2 hours from corner to corner. I think geographically we're one of the bigger counties, even though our population is dispersed. So that's a little bit about Somerset. This slide is quite a nice one. I quite like this. It gives us a bit of a context for the people of Somerset and some of the challenges that we have. So if Somerset was a village of 100 people, this is the kind of breakdown of what that village would look like in that sense. So we have got some real pockets of deprivation in our communities. We have some real issues with access and people not having a car and being able to access services. We have a high number of people actually that are overweight and obese. We have life expectancy, which is high, but as I said, healthy life expectancy is considerably less than the numbers on there, and that's for us a real challenge. And we've got some real issues with digital exclusion. So as we move forward with our thinking about how we want to care for people, often digital is given as a solution, and I think we need to be cognizant that while it is a solution for many people, it's definitely not a solution for everybody at the moment. I'm very happy to share these slides. So those are some of the challenges for us. We've got some high levels of coronary vascular disease in Somerset, and one of our first priorities is to focus on improving things like hypertension management, which enables us to prevent people having strokes and heart attacks. And there's some really good evidence that you can intervene early, and actually you can get some early wins with that. So a little bit about the integrated care system in NHS Somerset and who are we? Because people quite often, people know who the hospital is, they know who their community services are, they know who their GP is, but people don't often know who NHS Somerset is and what our role is. And we've created this. It's a bit of a kind of simplified narrative really as to what NHS Somerset is and what through the Care Act our role is. And in essence, we've picked up a load of responsibilities from Somerset Clinical Commissioning Group for allocating resource. We get the budget for the NHS in Somerset, which is just around £1 billion, and it's our responsibility to make sure that public resource is used effectively to commission services for our population. But our role is so much wider than that, and I think we're moving away from an arrangement where that relationship is quite contractual and quite transactional between different parties, to one where our role is very much around breaking down barriers. I talk to people about the NHS and people think, well, the NHS is this one organisation, and of course it's integrated, isn't it? And I think many people know through their personal experience with the NHS that it isn't sometimes as integrated as it can be. And the Health and Care Act has put in statute that requirement for organisations within health and care to work together. And for me, this is really exciting and gives us that sort of opportunity to modernise how we do things and join things up so that we can provide better services for our population, right the way through from birth through their life and into old age, so that we can support people to live well for as long as possible. So our role, the sort of words we use, is around convening, it's about collaborating, it's around creating those partnerships, but it's also about holding people to account and making sure that actually we deliver the best possible services. And I think as time goes on, it's very much around improving outcome. It's very much around focusing on the health of the population and improving the outcomes for people, rather than necessarily managing all the input. There's an awful lot of input measures that certainly as an NHS we've historically been held accountable for. and yeah, we have to recognise they're not going to go anywhere. They're not going to change. They're a political imperative. But the big dot and the big focus for us has to be about improving outcome. This slide just talks a little bit about there were within the statute. There's four broad aims of NHS Somerset. One is, as I said, to improve outcomes. The second is to tackle and identify and tackle inequality where that might sit within our community. It's to make sure that our services are as productive as they can be, and it's also to recognise that the NHS is a massive employer, and therefore we have a social and economic responsibility to develop our workforce, to develop our people, to work with communities and young people to make, for example, Somerset an attractive place for people to come and live and work. And we do that through a number of rooms. There's legislative levers that we can pull. We have a responsibility for designing services, but we're going to be doing that in partnership with people rather than sitting in a darkened room and doing it, and commissioning those services. From next April, we get delegated responsibility for a number of other primary care services. So we're responsible for GP services in Somerset, but from next April, we also get responsibility for optometry, community pharmacy, and dentistry. And I'm acutely aware of some of the issues with dentistry at the moment, and that's going to be with us to try and resolve as we go forward. At the moment, those three areas sit at a regional level with NHS England, and we have an oversight role, making sure that our providers deliver good quality care to our population. The how is really important, and I think I've said before, this is about working with people. It's about working through people. It's about joining up care. I think when I think about the new things that we've done that have been the most successful, they've been the things that we've done because we've co-created them. We've listened to people. We've listened to communities, and we've had a really different approach to designing and delivering services. But just think back to the sort of pandemic and the rollout of the vaccine programme, which I'm sure loads of people on this, in the Assembly were part of. That was a great example of how the NHS, the voluntary sector, and the local authority came together to deliver, services literally overnight in a very different way. So it's about local solutions. It's about taking a population health approach to enable us to identify where there are differences in outcomes within our population, and then really target that at a local level. And it's also about delegating responsibility for some of this stuff to local communities and to providers locally wherever we can. We can't get away from our statutory duties, but what we can do is delegate some of the responsibility for the delivery of that to local level. So again, we start to get solutions that mean things to people. So what I'm hoping that I'm signalling here is quite a different approach for the way that the NHS works with the local authority to deliver kind of care services, with the voluntary sector, and with a whole load of other partners, but critically how we listen to communities and how we engage with people. I think again, the NHS has a history of engaging with people when we have something that we want to talk to you about because we're going to make a service change that people don't necessarily like. Actually, we have a statutory duty to do that, and there'll be some service changes that we will want and need to take forward. But this is about so much more than that. It's about properly engaging with communities, and it's about making sure that everyone has their voice heard and everyone is able to work together to remove those barriers. Because I think, for me, that gap between healthy life expectancy and life expectancy is the one that we absolutely want and need to close. We need to be supporting people to live well for longer. So you can see there our approach, and an approach that's focused on measuring outcomes. It's about measuring what matters to people. And again, as I come in a minute, I'll just talk very briefly about our emerging strategy. But what we're thinking about here, and again, what we're interested in getting some views on, is as we measure our strategy, one of the things that we're thinking is a really key thing is time. And it's about how we can value people's time whether that is the time that you spend when you're in hospital, not having to ask questions and answer the same questions 4 or 5 times, whether it's about the amount of time that you spend in hospital waiting for the next part of your treatment, or whether actually it's that bit about we want to value people's time because we want to absolutely reduce the amount of time that people are living not well. So time is a great measure, I think, and that's something that we want to kind of come and get people's responses and ideas around. But for me, this is all about co-creation. It's about trusting and developing those collaborative relationships, which means that we can kind of move forward together. From an NHS Somerset perspective, we've set ourselves 3 initial priorities, and this is very much until March 2023. Because this is it's kind of a question about where do you start, and let's be really clear with people about what we're focusing on in the initial 6 months. So the first one there, I think everybody's recognizing that we've got a really challenging winter coming, and we want to play our part in ensuring that the whole of this system delivers the best possible outcomes for the population through the course of the next 3 or 4 months. We also want to take some action on health inequality, some early action. We've been building a population health management approach, working with Trudy Grant, the Director of Public Health. And again, I think an early priority is coronary vascular disease. But we also want to do some things like beginning the conversation today about how do we create relationships and structures that enable us to work much more easily with partners across the system. Let's get the groundwork right for this. And then thirdly, developing our Somerset Health and Care strategy, which, as I said, has to be overseen through the Integrated Care Partnership, but is something that we want to co-create. And I think, within the statute, we've got a responsibility to publish something by Christmas. We've been working on this for quite some time now. We will do that, but it will be an iterative process, and it will evolve and develop from there. So I think we recognise absolutely that what we publish on the end of December will by no means be the finished article here. And that sort of segues me really into the sort of strategy. And again, this is a really busy slide. I'm very happy that we share the slides after this. But in essence, what this is saying is we're not starting from scratch. We've got a county vision that has been developed over many years through the Health and Wellbeing Board, which is our Improving Lives strategy, and this is the sort of guiding light for us really. And the NHS part of this, if you look at the right hand side of the slide, the last point is a county environment where all partners, private and voluntary sector, focus on improving the health and well-being of our communities. That element of it is the bit that's our health and care strategy, but it fits in directly with the overall improving lives strategy of the county. And I think that's where the connection between the Integrated Care Partnership and the Health and Wellbeing Board will be really critical, because it binds the two absolutely together. We've had our Fit for the Future vision for some time now, which is effectively how we're going to deliver that fourth bullet point there. And it doesn't seem it seems like a good vision. We've engaged on it very generally and co-created it. And why would we go back to the drawing board and start with something different? So we're kind of recommitting we're making a commitment to that vision, that the overall vision being that in Somerset we want people to live healthy, independent lives supported by thriving communities, but when they need access to timely care, they get it through high quality and efficient public services. So they're there when you need it, but actually our focus is very much on prevention, it's very much on early intervention, and it's very much on supporting communities. And for me, I think we've talked about this for a number of years. I've heard this narrative play out for a number of years in Somerset, but we've never actually delivered it, because the money has always gone to the second element of that and not to the first element. And I'm determined that through this we will start to see that shift. We spend about, just to give you a bit of a sense, of every pound of NHS money in Somerset, we spend about 50p on hospital services, and the other 50p on everything else: mental health, community, primary care services, etc. And what I'd like to do is to see a shift in that 50-50 balance towards a greater emphasis and more pennies in the pound being spent on prevention and early intervention as we move forward.
Jonathan, can I did you have more to say? Because I'm quite keen to move into the participative bit that
sure.
you mentioned. Brilliant. I thought you were pausing. Yes,
that's all right. There's
do.
a couple of things that it'd be great just to tease out for people, because I think this slide here is quite critical in a sense, and it'd be good to get people's sort of reactions. But there's something about I think in the past we've had a lack of focus on population health and prevention. We've talked about it, but we've not done anything, or we've not done enough. Our pathways are fractured and they're clunky, and we need to improve that for people. I've talked about the resource spent on hospital versus other things. We've got inequality in our population, and I think COVID has made that worse. And actually, for us critically in Somerset, given the age profile and the demographic of our population, there is a need to have better coordination of care for people with complex needs. If you want to get into the engagement bit, I think this diagram here really is about what we're trying to do. So it's about making sure that we put more of our attention on level 1, people living well in communities and providing advice and support in communities when they need it. And you know, our focus on inpatient and emergency care, whilst absolutely important, is one where you know, we want to put more emphasis on the level 1, level 2, and level 3 within all of this. So I'll pause at that point, and because it would be good to get into a discussion.
Welcome back, everyone. You were just hearing the tail end of the elite group who were forced to stay in the main hall because their technology didn't allow them to get into a breakout room. We've eaten all the croissants that were laid out for coffee time. I'm sorry about that. So the rest of you are going to have to sort yourselves out later. Thank you very much for people doing about 3 things at once. Actually, I've just realised our heater is really loud. I don't know. Which involved reflecting on what they'd heard, perhaps setting aside the things that they were dealing with before they joined the meeting, thinking about using Menti and writing down what they thought, or listening to other people and writing down what they thought, trying to remember what the questions were in the first place, and have we answered them all. So it's quite a lot. There was quite a lot there going on, but I hope you felt able to share your views and thoughts, and probably generated some questions. The reason we're kind of going on about writing it down is it's easy to lose good words and good thoughts in the heat of the moment and in the dim corners of a breakout room. We really want to work with Jonathan and Charlotte, who you heard from earlier, to create good communications and good places for the right questions to be asked, and even if they can't be answered, to at least be recognised as inquiries. We're showing you now the results that came through Menti. I hope you can see those, and perhaps you can see something that your group raised, and perhaps you can see new points. Jonathan, we've got a few more minutes, but I know you had originally said you needed to go at 11. Is that still true?
I can stay, Charlotte.
Okay, cool.
It's not a problem.
And I know that you were in one group, and so heard perhaps a bit more in depth. I just wanted to reflect briefly on what I heard in our group. I mostly went off camera and did some breathing exercises, but I did listen to what was being said, and then maybe you could just reflect on what you heard, or anything you've seen coming through on Menti, and we'll look a way forward. And then if anyone is sort of burning to give some feedback from their group directly, or ask, you know, a really big question of Jonathan, then we'll, you know, try to provide a few more minutes of that. I'm sorry we don't have time to sort of give all of the discussion time that you might well want, because we've got other things to do on the agenda, but your questions will get answered and your feedback will be received and we hope responded to. What I was hearing in our group was things like concerns around digital, a move towards digital services and the inclusion piece, hearing that there will be greater reliance on local communities and perhaps some concern in, well, how will that be managed and supported? Recognising that there are a lot of challenges and that these are not just in Somerset, this is national, and important that we keep that perspective, that we can rather easily get focused on challenges and not necessarily also reflect on what's working well. There was a question on, well, how does public health fit in? I'm just illustrating that in a few minutes with a random group of people coming together, we can come up with a real variety of points. Another what seems, perhaps a great question of detail was simply around data sharing and protocols for how people in the voluntary sector can have common access to to systems and data held within the NHS. So anyway, a real variety, and I'm sure that was true in every other group. But Jonathan, if I just hand back to you, if there was any particular things from your group that triggered something, or if you've seen anything in Menti, and then if we've got a few minutes, we'll take any more burning questions from the floor.
Yeah, thank you, Charlotte. I mean, I would suggest, I mean, it's great. I'm just seeing the things that are coming through on Menti, and I think we need to give it due consideration, due reflection, really. So I'd suggest that we'll take away the output from this, and we'll come back with maybe some more specific feedback, and maybe that could be something that we just reflect on at the next one of the assemblies. We can write some stuff down, but actually it might be good for us to go away, pull out some of the key themes, and then have a conversation about and so what, because I think this is a complex system, isn't it? So this isn't easy. There's a load of stuff that's popping up here around. I think, I'm taking a message here that there seems to be some positive feedback about the focus on prevention, early intervention, and communities, but quite rightly an understanding and a concern about, well, so what does that mean for us as people working in communities? Are you going to chuck a load of things that would have been statutory services as us and not give us any money? I guess is probably the fundamental part of that. And I think this is about getting your solutions, and actually, if we're going to get this right, of course, as an NHS and as care, we need to put some money in behind this as well. This just can't be about supporting and expecting communities are going to pick up statutory, the responsibilities of statutory services which are under pressure. But we need to work out how we're going to do that and how we do that best. I think in my group we had some really good conversation and some really good examples of Mikkel was there, he was talking about the kind of diverse communities, and just some really good reflection then on I think how we might, sitting where we're sitting, make some assumptions about we're doing the right thing in terms of engaging with some of those traditionally hard to reach communities, but completely miss the point but it's well intentioned missing the point. And just through that interaction got me thinking about how we absolutely can engage differently and make sure that we are hearing from the people that really know, and that's kind of a key message from me. But I think there was one thing that popped up that really caught my eye, which was somebody made a comment about the ICBs already making decisions in isolation or in behind a closed door, and again, if that's the perspective, I can understand why that might be the case, but we're a public organisation. We have open public meetings, and I'd hope that we will be as absolutely transparent as we can be around some of that decision making. I think I would make probably a comment around resource, because resource is challenging and it is limited, and we heard the autumn statement last week, which is going to have an impact on everybody in the country in some way, shape or form. And the intelligence is that from an NHS perspective, we receive another £3.3 billion a year for the next 2 years. I think that was that was from an NHS perspective, that was a good outcome in the sense of everything else. And there's more resource going into social care, particularly to tackle some of the issues around discharge and interaction between health and social care. So we've got some opportunity to use that resource very differently as we move forward. But I'm also, it's within the context of those headlines are part of the picture. The bigger picture, both for the council and for the NHS, is going to be a challenging financial settlement as we move forward from next year. So those are just the realities, aren't they? And I think for me, this is the start of an interaction that we would want to build on. I probably won't pick out, because otherwise I'm picking out things randomly, and probably the best thing to do would be for us to go away, reflect, and come back in a bit more of a structured way to you.
Thank you. Thanks very much, Jonathan. Now, I want to give us a little comfort break, and then we want to flip our minds and start thinking about the local authorities, the districts and counties that are becoming one unitary council for Somerset. I know we've probably all warmed up talking and thinking about health, and we just want to carry on talking about the NHS, but we'll just have a little break and try and reset. And as we've said many times, and as Jonathan has said and Charlotte has said, we really want to see this as the start of a more substantive, open door, safe space engagement between the voluntary sector and the integrated care system, integrated care board. So let's keep the conversation going. But in a moment, we'll start to hear from Sara Skirton, who will be talking about the new unitary council, lovingly described as LGR sometimes, Local Government Reorganisation. It's the biggest reorganisation really since 1974. I know many of you won't remember that, and I was only little. So it is something to pay attention to within the voluntary sector, and to understand how it will affect us, or to rather think about how it will affect us. But for now, I'm going to give us a quick comfort break. I don't want to give you too long. There's no time to go off and write emails. You have time to go to the loo, maybe make a drink, do some star jumps, and make sure you're warm and comfortable. And we'll see you back here in about, we've said 11:15. Is that
Charlotte,
okay with everyone? If anyone wants to stay and just ask questions or chat, then that's fine.
Charlotte, just before I go, can I just say a big thank you, because I think it's just, this is a moment just to say thank you to all of the people that were involved in what has happened over the last 2.5 years, because quite frankly, we couldn't have done what we've done without your input. So I just want to kind of leave on that note, really. Massive thank you to all that have been involved.
Thank you, Jonathan. It was lovely to see you.
Thank
you.
Now
go and sort out all the problems that we've raised. Thank you.
I will try. Thanks a lot.
Thanks. Okay, see you all back here at 11:15, but I'm just going to stay on if anyone wants to come and have a grumble about Menti or Teams, or I couldn't hear, or any sort of practical things. We're here to help you if we can, but do go off and get a coffee if you could do that too. It's good to have a break. Welcome back, everyone. I hope you're all back in the room. Without further ado, I'd like to introduce Sara Skirton, who Katherine introduced earlier. Sara is the corporate head of service at Mendip for customers and communities, and is part of the LGR, a senior member of the LGR programme team. Sara, I'm going to hand over to you, if that's okay, and yeah, take it away. I think you're going to be speaking for a few minutes, and then we're going to have a question and answer opportunity. Please be kind. Please be kind. Sara stepped in at the last minute. We're so grateful, Sara, for you to do that.
Thank you. And just to say that Alan Jones, who is the Local Government Reorganisation Programme Director, does send his apologies. He really did want to be able to attend, but he had a conflicting priority. I am not the Programme Director for LGR. However, I am the joint lead for the LGR workstream that focuses on customers, communities and partnerships. And when I say joint, that's with a colleague from the County Council called Jan Stafford, who some of you may know already. So what I agreed to do was to give a quick overview of some of the highlights of the overall LGR programme. And then I'll say a little bit about the work that we're doing within my work stream, which links with I think a lot of what you might be interested in today, and we work closely with Charlotte and Katherine as well within the workstream, and other colleagues who I know are on the assembly today. So as Katherine and Charlotte both mentioned, from the 1st of April next year, a new unitary council comes into effect for Somerset. It's known as vesting day formally. That council will replace the current county council and the 4 district councils. As you can imagine, there's an awful lot of work going on to get us to that point. And the Local Government Reorganisation LGR programme consists of a number of work streams, which each have a responsibility for focusing on a set of services and functions. So how they will come together under the new council, how they will work. And the priority there, you might have heard the phrase safe and legal. I don't love it, but there's an element of truth to it. We have to be safe, we have to be legal as a new council. But the priority really from our customers and residents' point of view is that services continue to be delivered from day one. A lot of the changes that you would anticipate with the unitary will happen over the coming months and even years. So that'll kind of depend on the scale of change and what we're bringing together. In programme management terms, if Alan was here, he'd tell you that the programme overall its status is amber. This is mainly due to the fact that the people who are delivering the LGR activity also have the day job still within the councils, and obviously having to balance some of that creates pressures at times, but we're doing everything we can to manage that. And what I'm finding as a district council officer is that collaboration with the other councils is brilliant, and getting to know how they work. So good progress is being made overall, though. The programme is on track to deliver. You may be aware the new Chief Executive, Duncan Sharkey, was appointed in the summer and took up his post in October. And the next 2 tiers of senior management, so the senior directors, will be recruited in a new year. And internal consultation on the proposed structure is happening at the moment. One area that's quite key to delivering services is making sure that the core IT systems function as they should. So good progress is being made there. You know, the important things for staff, that they're all on a payroll system, but more important than that our customers and residents can access services from day one. There's an awful lot still to do, but we are clear that a lot will look the same to our customers and our communities on day one. And really, you know, hoping that a lot of the contacts that our communities have with people, perhaps in the districts, with colleagues in the districts, we've got some continuity there. And where continuity might not be possible, we're communicating about that, and people know where to go, who to speak to. On the overall programme then, I'm very happy to take any questions, even really difficult ones, back to Alan. I may or may not be able to answer some general ones, but if it's okay with everybody, I'll just say a little bit about the customers, communities and partnerships work stream and where we are at the moment. And then very happy to take any feedback, thoughts and questions. So one of the key tasks, as well as making sure that our customer contact, customer services and all our support for customers is working from day one, is also making sure that as we move to a new unitary, we're not making it more difficult for local people to have a voice and influence services, influence the decisions that matter to them. And part of that in the One Somerset business case was a commitment to creating something called local community networks. The idea being that they would bring together at a local level the unitary members, along with towns, parishes, partners in the VCFSE sector, but also partners in health, education, the police, to really look at what the local priorities are and come up with a plan for how they could be addressed. And that being something that a new unitary would take note of and would inform the way in which they deliver the services and their policy development. We are still in the development stages for local community networks. During September and into October, we ran a consultation and engagement programme just to ask people for their views on what the role and remit of local community networks could be, and potentially what their geography might be. And this is something that so many people have got different views on, so we've still got a lot of work to do there. First of all, could I just say thank you to anyone here who responded to that consultation? We got some really, really detailed feedback that we're working through at the moment, and Charlotte's been working with us as well as almost as part of the team, haven't you, Charlotte, just to try and understand some of those different perspectives. From sort of voluntary and community organisations, some of the feedback was that smaller networks were preferable because you'd really get that local flavour, local intelligence, and it would be easier for smaller groups to engage and for residents' voices to be heard. Equally, and this is interesting because it goes back to Jonathan's presentation, a number of the larger organisations raised concern about if there were lots of smaller LCNs, how do they get that ability to engage? So how do they get that kind of economy of scale? And I think the big challenge for us collectively as a public sector and, you know, with yourselves is to work out how we work locally, but also don't lose sight of the strategic stuff as well. So some of those sort of cross-cutting issues. What I would say is that local community networks, the idea being is they could cover any sort of priorities that a local community could have. So across the whole economic, social and environmental. So health and well-being is really important equally, and it's associated, isn't it? But so could environmental issues or transport issues, or, you know, and anything really that might be of importance to a local community. And that is part of what their role is to identify what those priorities should be based on local intelligence, but also evidence and statistics as well, just to make sure it's got a bit of rigour. So the next steps, we've been working through the consultation findings. We've been looking at what other council areas where they have locality arrangements, what they've been doing as well, and what's worked for them and what hasn't. If you take Cornwall, for example, they've just reviewed their arrangements after a number of years and made some changes. So we've got some interesting learning from there. We also in Somerset have 3 local community network pilots that they're each very different, one from the other, and we'll be getting lots of learning from there. And we're taking all that information, having those conversations with a view to going back to Somerset County Council's executive in January to say, taking everything into account, this is what we think local community networks could do to start off with, accepting that they will evolve over time. So, for example, some people have said, should they do planning or licensing? The emerging view is they may have an influence on, you know, developments, but actually that's probably not their primary role from day one. And actually planning and licensing probably won't change much from day one because you've got ongoing local plans and arrangements. But they will be about what are the other priorities for the area. We will also be going there with a recommendation for where the geographies for LCNs might be. And again, we've got conversations to have with colleagues, including in health, to see how that can work with the arrangements with the ICS, but also with other partners, and making sure we don't lose that really local perspective as well. So we have got some challenges in the next few weeks to try and make some sense of that without going to a lowest common denominator, if you like. It's got to make sense. It's got to be justifiable. It's really important that we keep in touch with our partners and our communities as we go forward and we take on board people's thoughts. So I'm seeing things pop up in the comments and all feedback welcome. In terms of the sector, we have actually recognised that there is a risk that everyone's so busy in the LGR programme, we lose sight of, well, we don't lose sight, but we don't take the time we need to talk to people and understand the different perspectives. So we have established another work stream that sits within customers, communities and partnerships, which is about the VCFSE and how we work with yourselves, how we make sure that we're sharing information, how, you know, any concerns or ideas are joined together, and we take that into account in how we develop our approach to working with communities. I think what I would say is that Charlotte is going to be hopefully working with us on that work stream as well, to keep that link. And we would just really request that you continue to engage with us, talk with us, either through Charlotte and Katherine or direct to myself and my colleagues. Really, actually, sorry, Alan, really grateful for the opportunity to come along today because I'm hearing a lot of really, really good stuff. So if, you know, there was ever another invitation, I'd be more than, you know, I'd be very grateful to come along. But really over to people here, if there's any questions at the moment. I haven't got a presentation with me, but I do have loads of slides and information about local community networks. There's also a lot of information on the new Somerset Council website, which we can put the link in the chat for as well. And we'll shortly be publishing the report from the consultation exercise as well. So with that, I'll stop talking and hand over to anybody that wants to raise any questions. Thank you. Oh, somebody's asking what the work stream's called. Customers, communities and partnerships.
Thank you, Sara. I'm going to pick up the questions from the chat. I know you can see those as well. And if anyone would like to raise their hand, I know it's a really big audience, but we have got several more minutes. If there's a burning question, and please ask simple questions. You know, if you just want to be reminded what's a unitary council, if there's anything basic, please, you know, there's no such thing as a stupid question. Nigel, I can see you've literally got your hand up. I can absolutely see you waving your hand. I'm going to ask you to speak and ask your question, and I will look at the chat and see if there are others that we could ask Sarah. Nigel, please speak.
Could I ask my main question is about the financial implications of all this. I'm unclear at the moment what the finances are of the yes, the different local authorities who are combining to form Somerset Council. Will Somerset Council start off in a financially sort of healthy state, in spite of integrating all sort of the finances of as district councils, or not? And what sort of implication will the government's plan to only give 5% increase to the council for the next financial year mean when inflation runs at 11%?
Thank you, Nigel. I am not an expert on the council finances, but I'll try and answer a general level now and get some more information for you from the team. So there is significant budgetary pressure. The whole issues around inflation, etc., mean that the new council will be challenged to fill what is a budget gap for year one to set a balanced budget. That will go to the Somerset County Council full council in February, is my understanding, so how they intend to do that. But you're right, it will be bringing together all of the district budgets, which I understand are all slightly different in terms of how, you know, how healthy they are or otherwise. But I think some of the challenges that the new unitary are facing go much wider than just local financial management. It is some of the wider drivers around things like inflation, and still waiting for the government settlement as well, which I understand will be December, to understand that as well. But I'll try and get a little bit more information out, Nigel, if that's okay. Thank you.
Thank you. Sara, there's a question which we saw quite often in the consultation, but perhaps just the current position on local community networks and primary care networks, LCNs and PCNs, wonderful acronyms that we don't always understand, but basically we've got some thoughts, haven't we, and a way forward on thinking about alignment. But do you just want to kind of cover the position on this boundary thing and alignment?
Absolutely. I think, as mentioned, we have not proposed a final solution yet on geographies, just because of that broad range of perspectives about some people thinking that local community networks should be very local. Some of our towns and parishes think there should be just rural ones and urban ones. We're not sure how that could work. We are also mindful of the fact that we really do want to align with colleagues in health and social care and through the ICS. So we've got some conversation scheduled over the coming weeks, and Jonathan might not know that, but we'll be contacting him to find out his availability very soon, because I think the starting point is really, what have we got in common? What are the outcomes we can work to? Because none of us have the capacity or desire to duplicate. So there isn't a decision about whether it could be coterminous with primary care networks at this point. It's something that's there for consideration. We need to understand that, and whether that really reflects the primary care networks really reflect the way communities see things coming together. So I think there's a bit more conversation to have there. But it is, as somebody's put in the chat, it is, yeah, I think there could be movement in both directions. I think nothing's carved in stone there, and it's about really what are our objectives here, where can we move things on both sides. There's a whole range of factors. There's going to be a boundary commission review in coming years. We need to be mindful of that as well. So the main thing with local community networks is what we start off with might have to flex over time. But given all of those different drivers around aligning and joining up with ICS, we'll do our best to start off with something that's sensible. So I don't have the answer yet, but we totally take on board the points. They are very well made, and we'll report back. As you know, that report in January, we will have to have ironed this out and come up with a sensible view that hopefully all our colleagues can say, yeah, okay, that makes sense. I think I just go back to the point that LCNs could cover topics wider than health. I know health and wellbeing is massive, and community wellbeing is, if you sort of look at sustainable development, it's fundamental, but we just need to make sure that we've taken other stakeholders' views into account as well. Thank you.
Lovely, thanks, Sarah. I'm going to invite Denise Dennis to ask her question, please.
Hi, Denise, you're on mute. No. Is it just me who can't hear Denise?
No, it's not just you.
It's not just you. Denise, we're not hearing you. Can you hear us? Okay, so you might need to come out and come back in, or could you put your question in the chat and we'll get it answered.
Maybe come back to Denise in a minute. Dave's got his hand up. Dave,
yes, I know he is. Yeah. Dave, do you want to speak? Obviously, this.
No, I don't actually. I put it in the chat. It was just to let people know there are officers from the councils who sit on both the partnerships and the VCSFE sub-work streams for LGR, so we might be helpful to people.
Thanks, Dave.
Thanks, Dave. And it will now that the new work stream has been agreed that we'll focus on the voluntary sector, we'll be communicating more about that. I think someone asked about how to get involved. So this is not Spark trying to control everything, and certainly we don't want to be in all of the meetings, or indeed any of the meetings. But it is about us trying to help get enough sort of representation and participation in appropriate ways. So bear with us while we work things out. But yes, if people are keen to be more involved, the point of the Assembly and the new engagement framework is to create ways that the voluntary sector can be involved in ways that suit us at a time and place to suit kind of thing, rather than just one way. Thank you. Now, has Denise put her question in the chat, or are there any others?
I can't see it. There's a number of suggestions, Charlotte.
Okay.
Considerations.
So, Sara, far away. If you're picking things up in the chat, do pick it up.
Somebody's mentioned about bus routes being considered. We have looked at travel patterns and including travel to work in some of the information we put out for consultation. So it's a very valid point as well. Also schools, particularly secondary schools, people are saying we need to really think about where they are and the catchment areas. There's so many different dimensions that we need to take account of and prioritise in terms of coming up with some lines on the map. I think what I would say is really important that we know that communities will never neatly fall into any lines on maps. We do not want to stop that collaboration, if you like, cross-border dialogue, relationships. It's just we have to find some way of organising to bring people together in a what's referred to as a committee. But actually, the feedback has told us loud and clear, don't make it too formal. Give it enough teeth to get things done, but don't make it so formal that people don't think it's theirs. So that's some of the learning we've had as well. Just seeing it's a new message. Yeah.
Here's Denise.
Oh, thanks, Denise. A lot of organisations for sort of engage with. Will VCSE be the main group?
Thank you, Denise. It's a really great point. And one of the questions we added to the recent consultation was specifically on the point of, well, how will participation work and what are the barriers to participation? And yes, if your question is, you know, how will this assembly fit into that? That's why we're wanting to create the assembly. It's why Spark have been asked to increase its activity for engagement with the whole sector, and why we want to start being able to sort of map and have sight of all the different networks that are already in place and flourishing in Somerset, or maybe are struggling, and we want to be aware of that and ways that we can help people engage in ways that work for them, and can kind of escalate issues into a more joined up system. So yes, the Assembly will play an important part, but it's not the only way in which we want to help you access the information and support that you need, and to have your voice raised at the appropriate place, and, you know, and higher if things are not getting resolved. I was just going to wonder, I can see that Becky Wardle, who is, I know, is from Rethink and has been very much involved in the creation of Somerset's Open Mental Health Alliance. And Becky, you raised a couple of points, including the alignment with health and social care. Did you just want to give a bit of extra voice to that? Because mental health has been such a critical issue in Somerset, and we're doing something really creative and different in Somerset. So a little opportunity, if you wouldn't mind taking it.
Thanks, Charlotte. Yeah, absolutely. I guess the key things from my perspective are that there are lots of similar conversations happening in different places, and I know it's really complicated. And Sarah and colleagues, I don't envy you the task of trying to align or integrate or kind of join everything up. But I think it's absolutely critical for kind of many reasons, which I think we all know. I probably don't need to kind of go into detail. But having kind of one conversation with the right people and the right engagement, and Charlotte's brilliant that Spark are kind of doing the work around that to make sure that the voices can be amplified. But the more we can integrate rather than just align would be certainly something that I would be really kind of aspiring to and hoping that we can achieve. And I guess also, I think there's something in, obviously I would say this, but making sure that the kind of individual strands aren't diluted. That, you know, mental health has had quite a lot of spotlight on it, which has enabled things to really progress. I'd be worried if that ends up kind of being diluted because of any kind of systems or structures that are kind of developed through the work. But yeah, I'll probably stop there.
Thank you, Becky. Thank you. We've started to almost move into the next bit of reflection. So I'm just going to pull back to any further questions. Julie Cooper, you've got your hand up.
I was just thinking, what's really tricky, having been part of local strategic partnerships, is that if you try and be all things to everybody all of the time, there's people around the table who think, why am I here? And other people who think this is all too much above my head, which is a challenge that Sara's said. So I think the key thing to get engagement, especially for those organisations who are strategic and will think they possibly need to be everywhere all of the time, which will be a real challenge, is that, and for people who can't go out to meetings, I noticed the information about transport. You know, the more people you have in a meeting, if I'm more than about 12 or 15 people in a meeting, they're not very good at, it's not very slick about making any decisions, is what I'm saying. So I think to maintain engagement, there needs to be some thought about maybe other forms, like taking an issue, like, for example, citizens panels were really good around waste, where you understand why things can't be done, but you understand where you can change things at the margins, that sort of thing. But also making it really easy for people to find out what's going on at a meeting, or maintaining the hybrid. So enabling people who can't get to those meetings to sort of click in and think, well, is this something I might want to make a comment out, or send a bulletin message in about? That really needs to be thought out, because not everybody will want to be at every meeting all the time.
Julie. No, that's very true. Thanks. That's Julie, who's from Sedgemoor District Council, and will certainly be working closely with the local authority officer leads as we build up a framework. And there are a few things that are new, for example, a Somerset-wide assembly, but we're certainly not looking to replace anything that's already happening. It's a real strengths-based approach and linking up the existing good work. Very much take on board your point, Becky, about that new work isn't at the expense of diluting existing work. I think we need to see the assembly as an overarching umbrella rather than a really big thing. We want to link up with all the different networks and partnerships across Somerset. Katherine, is there any reflection from you, and for everybody else? Any more questions directly to do with local government reorganisation, the new unitary council? We've had the point about a bit more on understanding the financial challenges. Obviously, there's an ongoing journey for local community networks. But if there's anything more for Sara, Fran Hicks, I can see you've got your hand up, and then we'll move on to the next session.
Yes, we haven't mentioned the climate crisis, which actually is an umbrella over all of this. And in fact, the vision is for a society of well-being. So that surely has to come into all these negotiations. If we're going to, particularly, for instance, on the finances, things like donut economics and so on, we have to do things differently, not use the old systems that got us into this situation.
Thank you, Fran.
Absolutely noted, and that goes back to that economic, social, environmental being in balance, doesn't it, for community wellbeing? I know my colleague Julie will remember those from the old local strategic partnership days and sustainable community strategies, but I think the principles are still there.
Yeah. Thank you, Sara. As I said, if anyone thinks of more questions and can put them into Menti, we'll use that to shape how information about local government reorganisation reaches the sector, whether that's through the Spark newsletter, giving you signposts to relevant websites, papers, but we'll have a bit of time to think about how do you want to be kept informed about change too. Katherine, is there anything you wanted to reflect on in terms of the sort of earlier points about engagement and frameworks and so on going forward?
I think it's really just to kind of reiterate what's already been discussed. As we've already said, this is very much the start of the journey without that sounding, there's loads of brilliant stuff going on in Somerset. And as I said at the very beginning, I think this assembly is about bringing those conversations together, and it's about making sure that we're involving and listening to as many voices as we can right from the very start. We're going to have a subsequent conversation now about how that might happen with some ideas. So there are, there's been colleagues across the sector who have been having these conversations over the past few months, working with health, working with the local authority, and what we really want to do is widen that conversation out and out to involve many more of you. So to reiterate, today is just the start. Again, the same as Charlotte Callan said at the very beginning, I'm very welcome. I'm very happy to my contact details in here. I'm in contact with a lot of you anyway already, but please drop us a line, contact us with ideas, give us a call. We want this to be a really kind of collaborative way of working. It's about doing things really, really differently. So any ideas that you've got about how we can do this stuff better, please let us know. And just go back to Fran's point about climate. That came out really strongly in our research last year. It's a huge overarching theme. And I think all these conversations we're having here about collaboration, inevitably they play into that, because it's about us working more smartly together. It's not just about cost savings. It's about doing stuff better for so many different reasons. And I think it's really important that that climate bit of the conversation is something that is a thread that runs throughout everything that we do. Thanks, Charlotte.
Lovely. Thank you, Katherine. Right, we're now, if everyone is still okay, we're now going to move into the final third of today's meeting. And thank you, Sara. And I know you're going to hang around and be part of it. And
thanks, everybody.
We've got a number of people who are staying with us from the local authorities and health, and that's brilliant. The final third is just a bit of time for the voluntary sector to talk amongst itself, if you like, but bearing in mind all that we've heard already. And we're going to think a bit about data and insight, the insight that is uniquely held within voluntary and community organisations across this county, and its insight, which is often highlighted as a really strong way in which public services can be improved, and it's where we can learn about how things could be done differently, what's working well, with that overall ambition to improve lives for everybody in Somerset. Hannah is just going to share a slide because I wanted to just create a bit of time for us to think about what all this data and insight thing might mean. I'm playing for time now because she's still working out how to share the slide. So this is a load of words on a slide. I've done this partly. If anyone would like a bit of jargon busting description, drop it in the chat. And if anyone feels they've got good insight into what these words mean, perhaps they could ask for it. Okay, so Jenny can't see the slide. So on this slide, a load of words that we're seeing a lot of: demand prevention, social prescribing, local government reorganisation, community engagement, integrated care system, improving lives, early help, data and insight, collaboration, cost of living crisis, Ukraine and COVID. And that was just drawn from some meetings last week. There's an awful lot of information around in the system right now. There's lots of partnerships and projects. There's lots of grant funding opportunities, government initiatives, news headlines, worries and concerns coming up from staff teams or from our service users, and making sense of all of that is pretty challenging. So one thing that Hannah and I want to help with is, can we help people understand a bit more about all these different words and these different initiatives, and are there ways to get involved? So if anyone wants to ask for a definition of these things, or if anyone wants to explain or mention something, please feel free to use the chat. We wanted to get us thinking about the data and insight that is held within the voluntary sector. We really need to put a value on that and be able to describe and articulate it to make sure that people working within the public sector get a really clear view of what is held within the voluntary sector, what the voluntary sector knows and could contribute to. We're going to go into some breakout rooms to discuss that a bit more, and Hannah has put together some questions on Menti. But before we do that, we've invited Nigel Bell from ARC at Egwood to just have a little spotlight for a few minutes to describe his organisation and to kind of answer the question, if you visited me in my group in our space, what would you learn? And that's just a way of a bit of inspiration for us all to think about in our own ways. What are we contributing? What's going on in our spaces? What are we learning? And what could we share? So, as I said, it's all going to become, I hope, clear about what we're going to be asking us to think about. I'm going to ask Nigel to start speaking, and Hannah will share the Menti questions, or the Menti questions will start to be available in Menti. Nigel, are you there?
Yep, brilliant. Thanks, Charlotte. Good morning, everyone. I was given 3 minutes to bang all this out, so I'll be as quick as I can. And also I was given 3 little headings of what to work towards. So I'll keep it brief and simple and to keep it to 3 minutes. But if anybody's got any questions or would like to talk to me afterwards about any of this, then please do. The first bit I was asked to comment on was, if the system listened to you and the people you support, what would they learn? So essentially, for those who don't know what ARC at Egwood is, it is a therapeutic land-based day service provision. We've been operating for just over 2 years. And what we did was we just opened our gates to anybody that wanted to come. We weren't prescriptive on who that was. We support people of varying needs. We just see people as people. So we just wanted to support people. What we've learned from that is, because we've grown with the needs of the individuals, the people that come to us, not by dictating what we should or shouldn't do. So how we've achieved what we've done so far is we speak to and listen to the people. We find out actually why they want to come to ARC and what they'd like to get out of ARC. We see each person as an individual, regardless of their diagnosis, label, etc. We're all people, and people are people. We're very flexible with our approach, so we don't just do this every Monday, this every Tuesday. Actually, we try and tailor what we do to meet the needs of the individuals and meet the needs of their abilities, so everybody can feel inclusive. And we look to identify works to work towards the outcomes that people want within the realms of what we got. So we try and change things, do things, put things on that meets the majority of the people's needs. We accept that it's okay for people to come and do nothing some days. Some people just come, sit, have a cup of tea and chat all day and don't want to do anything. And we say to people that actually that's okay, because if you're not feeling it, the fact that you're still coming is great. You're not at home on your own. And eventually people do start to do stuff again in their own time, but we strip away any expectation or pressure and a need for an outcome. We give people a choice. We give people a choice to come to ARC. We give people a choice of what they do when they come here. In the early days, we meet lots of people that wanted to put somebody in a day serve provision because they needed to fill their week up. But actually, if you don't want to come to ARC, that's fine. You don't have to. But we generally find people want to because they've got choice and control of what they do. We structure our days very discreetly. So we have got structure behind. We know why people are coming to us. The staff know why people are coming to us. We know what outcomes people are working towards or not working towards. But we don't make that overly obvious. We just want people to feel that they want to go to ARC because it's a nice place to be. Next bit was reflections on how you can influence the system. We have a number of options where people refer to us. So you can get referred by professionals, you can refer yourself, you can refer by families, you can drop us a text message, you can email us, you can message us through Facebook. So we don't make the too descriptive. The initial contact has to be done a certain way. So people can pop up and say, I'd like to know a bit more about ARC, then we engage the conversation, and then we discreetly structure a kind of referral, finding out more information and finding out what people want when they come here. We also don't be too descriptive. Although we operate the day service 10 till 3 each day, people can come for half an hour, for 1 hour, for all 5 hours. We don't just say that you've got to come all day. Actually, people start off very slow, and over a period of time, the weeks and months build up until they start coming all day and getting more out of it for themselves. How can you work collaboratively with others? I think there's a lot of collaboration we can do. It's been very nice to hear some of the conversations today. I think there's more scope for us all to identify similar areas of work and support that are offered to give people choice of where they want to attend. Example is that ARC is an outdoor provision. There's lots of other outdoor provisions in Somerset that we could be working closer with. We could share ideas of good practice and what works well. We can collaborate on projects. An example of a recent project we've collaborated on is we just worked with the National Lottery, and I believe Sarah Dunaway might be here. I think I saw your name pop up, Sarah. So we spent 12 months working with the Watch Project in charge to identify a project which is Pathways to Partnerships. We were successful with a large lottery bid for the next 3 years to recruit 2 members of staff, because we realised within the Watch Project, they're very good with mental health inside, we're very good with mental health outside. So actually bring the 2 organisations together, sharing resources, sharing training, it gives people more choice and we can reach more people. And between us, we can actually do more work at linking with the great work and the partnerships out there. And I think one thing that could come out of today within Spark, the ICB, the SCC is organisations that you do intend to work with within the VCSE is get behind them to support them in funding bids, because I have found myself that if you get some weight or you get some kind of credibility behind funding bids, so some of the trusts and foundations we've gone to, by getting a letter of support from certain organisations certainly helps with the funding bid, and we've been far more successful where we've engaged in conversation with funders and got support from bigger organisations in Somerset than we necessarily do in isolation on ourselves. That is it.
Nigel, thank you so much. Thank you. Now, I'm aware there may well be 80 other Nigel Bells in the room and 80 other Arca Egwoods, and I know you'll appreciate it simply isn't possible to give everyone that same amount of airtime. However, for a future assembly, if anyone would really like the idea of just a small showcasing of their organisation, please get in touch. There's also lots of other ways to communicate just what is happening across Somerset, but we want to work on that to make sure we can give people like Jonathan and Charlotte and Sara, who we've heard from earlier, the best visibility in a fair and inclusive way, of course, not just the people who are shouting loudly, but ways that we can help amplify and illustrate the fantastic work that happens, if you like, at the real front end of the real front line of services. So we're going to move into breakout rooms. There's going to be about 8 of you. Please take a bit of time to exchange what you do. If you are from the public sector, public health or so on, obviously introduce yourselves, but the opportunity is for the voluntary sector groups to just illustrate a bit of what they're doing. There will be some prompt questions in Menti. Hannah, I think, they're in the chat. Thank you. They are in the chat. And you're going to be asked to just kind of reflect. Please use Menti again. The questions are really around, what can the system learn from you? If you are holding really amazing insight about what it's like to be at risk of homelessness, of what it's like to be on the low level depression or anxiety. I'm so sorry, the phone is ringing. Low level anxiety and depression. If you are holding that insight, one moment. Sorry. If you're holding that insight, please mention that in Menti. Describe what you know that you might feel is unique to your particular area of Somerset or your particular specialism within the voluntary sector. So over to Hannah. She's going to put you into breakout rooms. If anyone needs clarification of anything, drop it into the chat, and look forward to seeing the results. Thank you. Hello, everyone. Well, I've just rushed back from our breakout room, had to run up the stairs, a bit out of breath. We had heard some really interesting points made in the breakout room I sat in on, talking about how connected people felt to their in their theme, and the benefits of having a Somerset-wide network that connected them, the benefits to being able to share a voice, and so on. And people have been very kindly tapping things in to Menti, which again, after this meeting, we will share. We'll do a bit of analysis as well, but we will share so that everyone can see what everyone else said. The point of that was to really try and illustrate that the voluntary sector groups, whether they are very small and very new, or very large or very well established, learn things from people that that you're supporting or are in touch with you. And if you are able to find ways to share that insight, we can all work together to improve the system in which we work. It's about kind of making the system that works for people rather than people having to work the system, which was a quote I read some years ago, and it always resonated with me. If anyone else has got that kind of great quotes of what we're trying to achieve, do share them. It's always good to have communications. Right, Hannah is sharing those Menti points. Would any of the groups like to share any kind of particular insight or make any reflections by popping up your hand? Please, Carrie, please do. Please, can you add the Menti points to the chat? I'm not sure how easy that is, Jenny.
I'm doing that. I'm on it.
Okay,
for our
cool.
group. It was for our group. I am
Oh,
busy
I
adding
see.
them at the
Sorry.
moment.
Cool.
Yeah.
Cool.
Actually,
Okay.
I think a really good point that Jenny raised, and perhaps she would like to speak to it, is around funding and how the smaller organisations are really pushed out of funding bids by the bigger players because there seems to be some kind of process in place. And that's really a shame, because in the end you just have the normal big go-tos, and all the smaller organisations who are doing incredible work on the ground just can't, you know, push forward their projects. Jenny, would you like to speak to that?
Yeah, it's a bit scary saying it in this space, actually, but I'll say it. And
Jenny, you're very welcome. You're very welcome.
Well,
please feel able to say it.
I don't want it to reflect on me, because it's well, it will reflect on me. So it's part. I think the principle that I find really difficult to deal with is that we are pitted against each other, and it's so the system says there's not enough money to go around, so we have to compete with each other. And I'm aware, for example, that ARC got their open mental health bid fully funded, and we didn't get ours fully funded. And I know that there's a lot of issues within that. And I'm also aware that the lottery a few years ago fully funded a project by Somerset Wildlife Trust, which we said would cut across our work, and it has. And we tried to influence that bid once. There's a lot of complex things in there, but the issues really are that we're being pitted against each other, and there isn't the ecosystem in place for us to be able to collaborate. A part of our conversation that Laura said, I think, spoke to really well, is that, you know, in a lot of ways we can't change that system. So for me, there's something about a kind of radical acceptance of knowing that the system is going to be really difficult for us, but also to try and change the system where we can change it. So there's both of those things going on. And personal, and it can be very difficult for those of us running really tiny organisations when you feel that you're doing something that's really good. You don't have a high enough profile because you can't get to the meetings, because you don't have the core funding to get to the meetings. So then you don't have a high enough profile, so you're kind of caught in that thing. So that's why I'm here today, even though I'm not being paid for being here. We need to raise our profile so that we can get the system changed. So there's a lot of courage that it's going to take from those of us who are really small.
Jenny, thanks so much for that. And you sound quite a courageous person, but if it did take courage to speak up, then I appreciate that very much. Diversity is always about speaking up, creating inclusion and level playing fields, and equality and so on is all about speaking up and having a grown-up conversation. I don't know whether it was your point that has prompted 4 people to put up their hands. It may well have done. If anyone else has questions, pop up your hands, but I'm going to come to you in order of speed. Please be brief.
Charlotte, just before you do.
I'm sorry, I'm being asked by Hannah to do something.
I've stopped sharing because, Jenny, I don't know that if you could see it, but there were so many people nodding along with what you were saying. I think there's a lot of agreement in the room, and I just wanted you to know that before we move on.
Thank you.
I can't see it, but because I can't see the images, so it's probably making it easier for me to share, actually.
Charlotte, do you mind if I come in on that? It's Katherine.
Yeah, please do.
Yeah. Hi, Jenny. You and I have chatted, and I completely agree with everything you said. I think it's a really difficult situation. I think we've made some moves forward, because I think has been a change in the way that commissioners commission, in that they are at least looking at smaller organisations now, which is a real step forward. What I was going to say was funding and sustainable funding and competition came again as one of the main things that came up in the research that we did last year. And one of the things that we're wanting to do is create some small subgroups to take those themes forward. If you'd be willing, Jenny, I'd be really keen to have you on the funding group to kind of talk about this as a strategic issue. One of the things that we're going to do as well is we're going to pay people for their participation. We're not expecting you to do it for free, because we at Spark totally get that. You know, we totally get that for many of you, you're giving of your time and you're working really hard, and we don't want you to do that for free. So if you'd be willing to do that, I think that would be really helpful. The other thing I would say is there are funding forums that we run. So Lorena, funding manager, runs those. So you can get support via those, but also it's a place where you can have these conversations. And again, what we want to do is collate these conversations and make sure they're heard. The third thing I would say is Somerset Community Foundation have been running funder forums where local funders get together and again talk about these thorny issues. We've not had one for a while, but I will chase that up and see when the next one is. So we go to that as well, and these are the things that we're saying all the time. The very local funders, we can hopefully influence the way they make their decisions. It's more difficult, obviously, with organisations like the Lottery and Children in Need, but certainly they're part of the conversation. I don't know whether Sarah's still here. Actually, I don't want to put you on the spot, Sarah, from the Lottery. Sarah Dumaway, but if she's still here, I don't know whether you've got any comments on that. But yeah, there's a couple of points that we can take forward, and we'll be in touch, Jenny, if that's okay.
Yeah, I'm definitely still here, and as you know, very keen to be a part of the Funders Forum, and have been really keen to have discussions about how funders and commissioners can work more collaboratively together. But Jenny's point is absolutely right, in that there is not enough money currently in the system to go around and fund all activity, and therefore, particularly from a large funder's perspective, we have to look at those applications that have the strongest fit with the priorities and approach that we have. And therefore, there will be some great organisations out there that are doing really, really great things. But because they don't have that clear fit with our priorities and approach, or don't have as strong a fit with our priorities and approach, we're just not the right funder for them at that time. And that's a really hard message to put across. But, you know, that there is local presence on the ground. We're very happy to have conversations with people about, what we're looking for, but ultimately we grapple with, and I believe that our decision-making processes are very robust, and I'm happy to talk about those as well if anybody would like more information. But we really do grapple with the decisions that we make, where we are, 5 times oversubscribed the funding that we have available in any particular area. So. Yeah.
And just quickly following up on that point, sorry Charlotte, Sarah, the comment that you made about sometimes you're not the right funder, that is the case sometimes. So again, that's what we're here to help you with. If you don't get funding with a particular funder, come and talk to us and we'll see what other options, and we're really happy to help you to do that, because we appreciate how difficult this is, and so we can help you potentially shape your application so that it fits. And similarly, we can look at what the other options might be in terms of some other funders that maybe that you're not aware of as well.
Thank you, Katherine. A couple of people have had their hands up for a while. Dave Crisfield, then Katherine Armstrong, then Matthew Byrne. Dave.
Thank you, Charlotte. I just to sort of say that from a local authority perspective, and if any of my other local authority colleagues want to correct me or whatever, that's great. I mean, it's a really interesting question. I mean, I think partly that it's maybe a problem just with the way that the funding processes operate. If it's about competitive tendering, well, then I think unless culturally, and this is maybe something for the new authority, is much more effective at promoting collaborative working, and really promoting things like having maybe a lead contractor, but encouraging subcontractors, which might be a way of bringing in the smaller, then I think it will always be, to some extent, it will be competitive. Therefore, I think it's important that in terms of the voluntary sector's lobbying and the work that we're going to be doing internally for LGR, is that the new authority retains some kind of a grants programme. If it ties up all its funding to the sector, either through contracting or through core funded organisations, Spark being a good example of an organisation we core fund, then certainly a lot of the smaller groups are going to be shut out in terms of local authority funding. So I think it is important that as part of that piece, you know, a discretionary grants budget is retained to enable particularly smaller groups to come in. And I think also and maybe, you know, the reality is when push comes to shove, people are competitive, and in some respects the voluntary sector is no different from others. You know, that if actually, you know, I've worked with the voluntary sector for over 30 years, and in all that time, you know, when push comes to shove, if there's money to be had, you know, people will trample over others. You know, and sometimes the ethos of the sector gets lost in that rush, you know, to be first in the queue. So there is maybe something culturally to be done within the sector itself, you know, for themselves to be more open to the ideas of collaborating and making, you know, maybe these kind of lead contractor, subcontractor relationships. I'll shut up.
Thank you, Dave. We look forward to the local authority officers following things up and securing as much as possible in terms of a culture that understands the needs of the voluntary sector. Thank you for your work on that. Katherine Armstrong, sorry to have left you there with your hand up for a while, but please pick up.
Thank you. Thank you, Katherine Armstrong from the Smart Communities team. We're part of the CCS group, and I think I just really want to pick up on what's been said, but I think there needs to be a better understanding and acceptance of collaborative bids to commissioners, because we found in recent times where we've suggested that we do a collaborative bid that's not been accepted, and therefore it makes us be competitors rather than collaborators in some instances, and we would really welcome, you know, where we know that there are partners of all shapes and sizes that can deliver elements of bids. We would really like to work with them, but we're often exempt from doing that in our bids. So I would really welcome, you know, the new authority and other funders really thinking about that culture of collaboration rather than competitiveness, and that would enable the sector to be more collaborative as a result of that. Thanks.
Thank you, Katherine. I don't want to react in the moment too quickly. We'll do some more timely reflection and evaluation, but it is starting to feel to me as though a further assembly that focuses on the money flowing around the system would be a useful overarching Somerset conversation to kind of kick that off. But we need to kind of regroup and reflect on the priorities. But the points that have been made around the future ways of working, around commissioning, around thinking about collaboration and bids and small voices and large voices and so on, that feels like this feels very timely. It's a good time when change is afoot. It's a good time to say what that change needs to look like and influence. Right, Matthew, have you put your hand down? You seem to have disappeared from my list. Did you want to speak?
I had put my hand down because I thought you were kind of wrapping up and about to move us on, but
no, please do.
And I was this actually came up in our group in the last session, the kind of you know, the elephant in the room of big organisations, and I speak as an elephant in the room, as it were. You know, looking around the room, I know that we're probably at CCS, we're one of the larger organisations in Somerset and present, and I shared with the group my view that you know, that we thus enjoy a position of, you know, of privilege. We're part of the Somerset sort of group that Spark convene. We have ears that aren't available. You know, we have the ear of people that others don't, and I think it's really sort of important that we own that as the larger organisations. I wanted to make the point though that also. I also wanted to sort of reiterate that, you know, how much I welcomed what Jenny said, and you know, the point that she made was really well made, and it's something that's kind of I think increasingly recognised in some larger organisations, that we are very, very lucky and we do enjoy kind of a privileged sort of position. I think the other point I wanted to make though was around the bit of the conversation that's missing, which is that, you know, no matter how collaborative we are, one of the challenges with more collaborative sort of approaches, and the really thorny issue for the commissioners to grapple with, is that, it's not just about sort of allowing us to collaborate, but delegating, I think, but actually sort of, possibly going back to recognising that some, genuinely recognising the value of small local provision that can't or won't be scaled. Because I think one of the things that certainly I've encountered in the past, I'm getting thumbs up from Jenny, I'm loving that, is that, it is this thing of, we'd love you to collaborate, we'd love to sort of fund the work, but could you possibly take it from just this part of the county, the country, the whatever it is, and scale it up everywhere? We think it's so good and lovely, but the thing that's good and lovely about it is that it's locally grown, locally owned, and beautifully and perfectly nuanced to the needs of that community. And the message that commissioners consistently fail to hear is that's why it works, not because of what it does, but because of the culture and the values and the way that it is grown out of the community. And that doesn't just make it difficult to scale, it makes the question, can you scale it, almost nonsensical. And that's a real thorny issue. So when we talk about funding, I think we need to talk about more than just how do we make sure that funding flows, but how do we change those conversations at a slightly different level. And as I said, as one of the elephants in the room, I think as big organisations, we have a responsibility to sort of recognise that sometimes we get in the way of that, to really push ourselves and challenge ourselves to sort of push that debate on, or to get out of the way of that debate at times. And now I'm going to get out of the way.
Thank you, Matthew, and you are a very pleasant elephant, whatever others may say. I'm going to do everybody loves an elephant. Okay, now we are... Oh, Laura, so sorry. Laura has a hand up. Thank you, Laura.
Yes. Yeah, I just wanted to put in some comment as someone who works for the NHS and for the commissioners, and just to say I think I would be very curious and interested to explore how we might show impact based on those super local, super valuable pieces of work that are happening to address issues, and actually look at, is there a way? I mean, I talked earlier within a breakout room around, we talk about funding, but we need to also talk about investment. And it's a two-way thing. So those of us working with smaller organisations and the VCFSE, there's a lot that you guys offer that can't be offered in the statutory sector, and that's the whole point. And there's something around the two-way dialogue to learn and hear back. And perhaps there's some work that we could do, which could explore how we talk about, so we say well-being, but if it fits in one block over here and we don't consider that actually there's a piece of work happening on in another part of the organisation that's really important, and there could be a case for something to be made for, like, it's just about being a tiny bit more dexterous and seeing the value of applying something great happening in one part of the county and thinking about what's the value to something else, not scaling. I'm not talking about scaling and replication. I'm talking about seeing creative links laterally. And I also wonder about the fact that we need to look for value for money, obviously, but what about words like, or phrases like, social return on investment? And the social funding, social investment is something that's existed for a while. There are plenty of places and mechanisms. Could we, and it's a genuine question, could we as a commissioner be looking at how we address value in the system, and how we seek value? Yeah.
Thank you, Laura. There's a lot of food for thought there. And Menti is already showing itself to be a good vehicle for anything in the moment. And we'll also share contact details for you to send your private thoughts to individuals or some collective stuff back to Spark that we can go back and start working with partners to pick up on some of the issues. We're in the final stage now. Feels like we've talked a lot, we've thought about a lot of things, we're probably mentally a bit exhausted. Thanks so much to everybody who's stuck with us so far. Hannah is about to share a slide, which is something we wanted to leave you with, and we will share this out again with our slides. And this is just the beginning of a conversation that is looking at a new engagement framework that is across Somerset, which will tie into the existing networks and partnerships, but helps everything to join up, and in particular helps insights, concerns, issues and questions to flow up and around the system to ensure that people have the help and support they need when it's needed. And that might be people, as in residents and citizens, people working within the sector, within the system, people volunteering, whatever contribution we are making, that we get the help that we need, resources permitting, and that we're able to shape the way things work in future. So this simple slide is to just demonstrate there are 3 parts to the proposed engagement framework, none of which is set in stone. It's still fairly conceptual, but here we are today at the first part of that, which is the Somerset Assembly. It will be open to all organisations in Somerset, regardless of their size, status or stage of development. It's open to anyone within the organisation, in that it's up to you who you send. We're not saying it needs to be this or that role. And we've got a question about how will it be chaired going forward. We need to think about that. There will be a steering group that works on behalf of the sector to influence the agenda for the assemblies, to make sure that any feedback and evaluation that's been received from people, any reflections, is acted on and shaped, who acts as a sort of an accountable body for the framework. And we'll be looking at the detail of that in the next few weeks or few months. And then the leaders group, that is particularly to do with NHS boards, integrated care boards that are starting to emerge by law, by mandated guidance from the NHS England. Those boards need to have voluntary sector representation. And so we need to come up with a process whereby people who have the opportunity or have the insight that's needed, have the willingness and the energy to take part, that there's a fair and transparent way of getting involved. But there are also many thematic and place-based groups, and people may well be representing the sector on those. And we want to start reaching out and supporting those people to ensure that any system-wide issues or system-wide insight can be drawn out and put in the right place. So that's the 3 parts to this new engagement framework. As I said, it's not about ripping anything up and putting something brand new in place. It's about building on what's already working well, and it will be a sort of iterative process over the coming months to make sure that people are clear on how to get involved, be more involved, where to share their voice, and so on. We've also got a bit of Menti to share. I'm looking at Hannah, she's nodding.
Charlotte, can I quickly come in on that?
Please
before
do.
we do that? Sorry, I was just going to say that the leaders group that we're talking about there is already a kind of an early iteration of that, which has evolved from something called the Somerset Group of Charities, which is health and social care charities across Somerset that have been meeting together for several years. And so that group already exists, and absolutely in keeping with the kind of the culture that we want to create here is about building on what's already there, not starting from scratch, and kind of looking at the networks and connecting those networks. So the Somerset Group of Charities already exists, but one of the things that we'll be doing over the coming weeks is looking at that and seeing whether it's got the right people around the table, whether that we need to look at new members, whether it needs a refresh, but that does already exist, and we'll be communicating with you more over the coming weeks about that. As I say, this is just the start. Becky's just asked a question. So is that going to come? Yeah.
Sorry, Becky. Katherine meant the steering group. The leaders group is not really a group. The leaders group are the people who are representing
the thematic
the voluntary sector, thematic leads, partnership leads, and representatives on the IC Integrated Care boards. And we're not cited yet on what all those are.
And that
the
might
steering
not be a group
is
necessarily.
The steering group is the version of the Somerset Group of Charities. So it's the steering group that will be looked at to be developed but we're building on the Somerset Group of Charities. The leaders group, as I said, is a sort of list of individuals who are not currently identified, but we will be looking to build on the people that are already linked in and already representing the voluntary sector or their own organisations on different things and partnerships. So it's the steering group that's the version of Somerset Group of Charities.
And I think the comment we were talking about earlier as well about the existing networks that we already know exist. There are thematic networks that are going on out there. Absolutely, this is about having a conversation and joining up with those. It is not about replicating. It's not about starting new stuff. It's about if the stuff that's already working really brilliantly, then we want to build on that. As you can imagine, it's a huge piece of work, though, because there's such a lot going on. This is a massive task. There's lots and lots of organisations involved and lots of different networks, and it's about creating a way of coordinating that's simple enough, but that also means that we enable as many people as possible to be involved in a way that suits them. So again, it's about small and large. It's about new organisations and old. And we just need to get that balance right. And it will be iterative as well. So we might not get it right straight away. And we want you to tell us if you think we haven't, because we want to kind of, this will be a movable feast and it will develop as we go along, and it will adapt and change according to the needs of our communities.
Thank you, Katherine, and thank you, Chris. You're absolutely right. We're not just talking about the integrated care boards for the leaders group. It's just that's one place to start. Another will be identifying all the different thematic mostly thematic networks and partnerships that exist, and to check in with those leaders who are leading those partnerships to see whether they in turn feel connected to the system and can take the voice of their partnership forward. Have you got the place where you can speak? Have you got the voice that you need? And do you feel in turn listened to and responded to? So there'll be some kind of checking in going on over the next few weeks. And as Katherine said, it is going to be iterative. We want this to be for, if not for life, then certainly for a good long time. And we need to take some care to ensure it's not railroading anything that's already in place, and that we take people. We work at a pace that works for people. Hannah is just going to share our final Menti slide, some of whom have already contributed. Thank you so much. If you feel willing to put down any closing thoughts and reflections into Menti, and you can stay to watch that flow across the screen, that should give you a good idea about how other people have felt. Please use this as an opportunity to say, how was it for you? I feel like I did too much talking towards the end, which is always a problem when I've had 2 cups of coffee. If the technology didn't work for you, if you would have liked more time for this or that topic, if anything wasn't clear, if you didn't feel respected or listened to, and you can find a constructive way of expressing that in writing, please do. If there's any final questions, add that in, put it in the chat if you can't cope with Menti. I discovered a while ago multitasking is actually not a thing, and we've probably asked a lot of people today to think creatively, keep strategic, but do detail, work with 3 bits of technology. The room I'm in is a bit cold. I hope you've been warm. If anyone wants to put up their hand and say anything because they're fed up of putting it in writing, go for it. We will finish by 1 o'clock, but I'm not going to talk much more. You'll be relieved to say, other than to say thank you so much for everyone that came. Spark are just trying to facilitate. We have been asked to facilitate and support and grow something, but your voice really, really matters going forward. So please engage and tell us what you need. Hannah will be sending out an email to everybody who signed up through Eventbrite. So if you didn't do that and you've got here somehow because someone shared the Teams link, please drop us a line to make sure you connect with the follow-up. We will use the Spark newsletter to communicate future assemblies. At this stage, that's what we're going to use. If you're not signed up to the Spark newsletter, I will leave it to your own devices to find out how to do that, but drop it into the chat if you'd like the link. It's on, you can get to it through our website. And we want to see more communication coming out to you. Don't forget about websites and read newsletters, but please do join in with meetings or influence the meetings that you want to have as well. Right, I really am going to stop talking. No one has put their hand up. It's been really good to see Menti. I think that's my big takeaway is it kind of works. And we've got so much in writing that would have otherwise been post-it notes on walls and somebody has to go away and type them up. And here we are, we've got it all in writing and everyone can read it. Lovely to see so many positive things. If anyone wants to give negative feedback, stuff that didn't work for you, but you'd like to do that privately, you can contact us at Spark. It's really important that we design things that work for the people that turn up. It's just hard to get it right for everybody all in one go.
Thanks, Charlotte. I'll just say final comment. So someone asked in the chat whether we would be automatically inviting you to the next one. Absolutely, we can do that. We'll do a general invite anyway, because like we've said, this is open to anyone who wants to come, but we'll certainly, those of you who signed up today, will certainly make sure that you're aware so you don't have to scrabble around for that information. As Charlotte said, we'll stay on for the next 5 minutes. If anyone wants to chat to us, we're here to continue that conversation. We'll share our contact details, but yeah, I think we'll finish now. So thank you so much. I've actually really enjoyed it this morning. I think it's been a really interesting conversation. It's great to hear so many voices, and very much hope to see you all in person at the next one. We're very much hoping to do something fairly early on in the new year, I think. So any thoughts that you've got for the agenda, let's keep this as open, continual communication. Don't just wait for the next assembly. This is ongoing. So any thoughts, drop them our way, and we're really happy to try and help you to try and feed your comments through and to take your ideas on board. So thanks very much. Have a lovely rest of your day.
Thank you very much.
Thanks then.
Thank you.